Hi, I'm Kevin Wade. I'm a senior therapist at the St. John Clark Pain Treatment Center, and I'm the campus director at the Center for Neurosomatic Studies. Both of our organizations are a bunch of very passionate people trying to educate you about neurosomatic therapy and the benefits to you and your health and your pain and anything else we can bring to you. Today, I'm going to have a little discussion with you about sleeping, one of my favorite things in the world to do. But really, honestly, it's not the favorite thing of a lot of people because they're uncomfortable when they sleep. One of the questions that we get asked most often in the clinic is, what about my bed? What about my pillow? What about my sleeping position? It's actually one of the questions we ask on our intake form. What position do you usually sleep in? And so we believe there are some things that are really important about sleeping position, and I'm going to share with you today what we feel at the clinic are the two best positions to sleep in, kind of your basic sleeping positions, and I'm going to share one with you that is not so good for anybody. So without further ado, I'm going to get a couple of examples up here, and we'll take a look at these positions. Okay, so let's start with how not to sleep. I'm going to go out on a limb and say pretty universally, stomach sleeping is a bad idea for everybody. And here's why. Most people sleep on their stomach with a pillow, sometimes flat on the bed, but that's even not that much better. So what we're doing is we're putting the spine into a little bit of an extension and tightening down all of these muscles that are coming down the back. Along with that, we can see that Lexi here has her head turned to the side. And if we're going to sleep on our stomach, we have to turn our head to the side. That puts our cervical spine into a rotation, into a twist, and then we stay there for hours and hours when we're sleeping. The other thing that we end up seeing with stomach sleepers too, again, depending on the mattress and the state of the mattress, is that the low back tends to curve too much here too. It kind of sinks into the bed and we end up getting some low back issues. There are variations of what happened down here, people with their feet sometimes straight out, sometimes kicked out to the side here. Now we're putting the hip into a shortened kind of position and very asymmetrical here as Lexi's trying to sleep. The worst part of this sleeping position is what happens in the cervical spine, and that's that rotation. In the clinic, we treat atlas axis distortions, malpositionings of those structures by releasing the muscles around them. And when you're in this twist, and most people tend to turn their head to the same side every time they sleep on their stomach. It's not like they switch back and forth, which would make it better, but it's still not great. So we start to develop these rotations in the cervical spine that tend to go to the same side all the time. We fix those up in treatment, and then our patient goes back home, sleeps on their stomach in that rotated position, and the cervical spine goes back into the distortion and the neck pain that they usually exhibit with this kind of sleeping pattern. So I'm gonna have at the end of this video a little bit of a secret of how you might change this position. Because most people will say, I love to sleep on my stomach. It's the only way that I can sleep. I've tried sleeping on my back. I've tried sleeping on my side, and I just can't do it. Well, there's a little bit of training. We have to change some neurological patterns in order for you to be able to get out of this position, but that's what we're all about anyway. So I'll show you a little trick to help you get off of your stomach while you're sleeping at the end of this video. So here we have a side sleeping position. Tony's on his side, kind of with one pillow here and nothing else. Now, side sleeping is really an okay position to sleep in, although many people find it to be uncomfortable. If you have a shoulder injury or shoulder pain, that can be problematic. Here too, again, we run into folks with certain neck issues and certain low back issues. And I want to show you how to make the side sleeping position better, more comfortable, and something that you can do to help alleviate any of those discomforts that you have. All right, so first of all, we're going to start down at the bottom here. There's a couple of things missing. What we want to do is support the knees and the low back here a little bit better. And in doing that, I'm going to grab a pillow from here, and we're going to use this one right between the knees, okay? So many people like to be stacked up, as we call it. The hips one on top of the other, the knees one on top of the other right here. And this is a great position. We don't want the knees to be too bent, like up in that crunched up kind of fetal position, because that, again, will tighten things across the hips here overnight. But a stacked knee position with a pillow that goes from the knee all the way down to the ankle. There's some products out there that kind of only support maybe the knee, But what happens here is then the foot falls down towards the table, puts some torque on the knee, and possibly some rotation in the hip. So if you can manage a pillow between the knees that covers the whole lower leg, supports the thigh, basically what we're going for is to have this upper leg parallel to the table, right? So we're in a nice kind of even position here, one above the other. Now, some people like to sleep with a knee thrown out in front of the other. So in that position, go ahead and straighten out your back leg there. Okay. Now, this position actually becomes pretty problematic for side sleepers. Here we put a huge rotation into the low back, and often that ends up being uncomfortable after a little while, and we get some low back problems. Here we need maybe something more substantial, a larger pillow, or I've seen different yoga bolsters and things like that that work well here. We'll put this thicker pillow out in front. Again, even this is not quite enough for Tony, so I'm just going to use an extra pillow to show you the position. And we'll put a lot of pillow right there. Again, we're going to support all the way down to the ankle so we don't get a rotation. Here we're better. The hips stay a little stacked up. Again, the thigh is parallel to the table, and we've got a good untwisted supported position here for the lower half of the body. Now, in this, once we've got that end taken care of, we need to take care of the torso as well. What ends up happening for a lot of side sleepers is that this arm will come up here, will be all cuddly by the face, and then the torso will start to roll down towards the table like that. Or these shoulders start to compress in, and we get a very collapsed chest kind of situation going on. So what we can do is support that, and I used my big pillow down here, and I need to use that for Tony up front. So let's go back to the stacked position here. All right, so we get back to that nice comfortable position here. So depending on the size of a person's torso, we might need to use, again, a smaller pillow or a larger one. This is a fairly large, firmer pillow, and what we're going to do is we're going to stick that right under the arm, have Tony hold on to that in his chest, kind of hug that pillow to the chest, and that actually helps to prevent that rolling forward and the collapsing of the shoulder into this closed off chest position here. So now we've got two pillows we have to manage. This does become a little bit of an issue when you're trying to achieve a good sleeping position, but I'm going to have you do something, Tony. I want you to keep that pillow between your knees and hold on to that pillow that you're hugging and turn over and lay on your other side. Okay? There we go. Did you ever practice that before, Tony?
No.
No, first time. It was that easy, okay? So what he's doing is just holding onto the pillow with the knees and the pillow at the chest, and those pillows come right with him as he turns over. Okay, let's do that again. Roll on to the other side. Now, the last little bit here that we have to consider is what's happening up at the head and the neck. I'm going to move that down so we can see a little bit better. A lot of people have an issue about what to do with this arm. Straight out in front, laying on the mattress is fine. I also find that if we scoot this pillow a little bit that way, it could be bent and kind of in a curled position here right next to the pillow. The one position we try to get people to avoid is putting the arm up under the head this way. It changes where the head is positioned for one thing, and it also puts a lot of strain on the joint capsule here at the shoulder. But the last thing we really want to look at here is the position of the head itself. Okay, a pillow on the bed underneath the head here should keep the cranium in line with the spine all the way down. If the pillow is too shallow, okay, the head will fall down towards the table, and then we get a flexion to the bedside. Or if the pillow is too high, we get it in here nice and relaxed there. The head's going to head up towards the ceiling, and we're in the opposite flexion, and that is problematic for these lateral muscles of the neck, anything that could shorten up and tighten in that respect. This pillow that we have right here is pretty good for Tony. He's got a nice straight line, and the spine is very lined up here. He's not twisted in any kind of way. And this is what we would call a very stable, very comfortable side-lying position. So here we have Alexi in a side-lying position. I just want to give this as a little bit of an extension from what we saw with Tony. Tony's got a very square torso, male hips, narrower, all of that. With Alexi here, she's got a narrow waist and wider hips and wider shoulders. So what happens in the side-lying position is her lumbar spine is going to kind of want to fall down towards the table, okay, or towards the mattress. This is where we get into a little discussion of mattresses, depending on how good the support is in your mattress. this may be taken care of in a good mattress. Your hips will sink a little bit farther in, the shoulders will sink a little bit farther in, and the mattress kind of rises to support this in a way. But if you can have someone check this out for you while you're lying in bed to see if your spine does kind of curve down towards the mattress like that, one of the things that we can do, and I'm going to just really quickly kind of take this out and we'll slide a pillow in. I want you to just push up on your side there. We're going to use a pillow here just above the waist and kind of fitting in the curve of the hip there. This pillow is just about right to support Lexi in a nice straight spine position. We may have even gone a little too far with this pillow, but you can get the idea of what you can do to support the lumbar area from curving down and going into the table into a lateral flexion in the sleeping position. Here we've got the spine all the way from the sacrum coming up through the cervical spine in a nice straight line, and that's what we're looking for. So it can be kind of hard to see all of this or experience all of this on your own. You may have to enlist the help of a partner to come and take a look at you while you're lying down in bed, come and look at you from the back, this side, looking right at the spine and looking for that straight spine. Okay, so this is how we would achieve, yet again, another nicely balanced side-lying position. Let's move on and do the back sleeping position now. So here we have Lexi in a back sleeping position, and this is your typical back sleeping position that most people get into. Completely flat on the bed and a nice big fluffy pillow underneath the head. But what we can see, there's a big problem with this right off the bat, is that this nice big fluffy pillow has pushed Alexi into a major head forward position. Okay, and this is what happens to, I would say, most people when they're trying to sleep on their back. You get these big down pillows, and they're not appropriate for your body size. They're not appropriate for the position that your head needs to be in. All right. One of the alignment kind of guidelines that we use is actually this chart right behind me, the Bachin skeletal chart, to look at proper alignment from the side. Go ahead and drop your head down here. If we look at the alignment of the body from this midline right here on the side, and we look at the torso and the head, I'm just going to show you Alexi's shoulder here. The middle of the shoulder joint should line up with the middle of the ear, right about here. Okay, this is good alignment from front to back. When we get too far out in front of our shoulders, there's other points to align here as well. The head becomes in this head forward. We tighten up all of these muscles along the front side of the neck, and that can even start to involve muscles down at the chest, and we get this rounded forward, head forward, neck pain, shoulder pain kind of situation. So for Alexi, she actually looks like she's in really good alignment there, flat on the bed. However, there's really, go ahead and lay back here, there's nothing supporting the back of her neck. Okay, now this can be a problem for people as well who find that this flat position works better but don't support themselves here. What ends up happening over time is the head will start to go into an flexed position, and the neck starts to press down towards the table, and then we get a straightened cervical spine. So what we want to do is find something like a roll, a neck roll. Some people use a towel rolled up, and you can find a towel that's just the perfect kind of diameter there. This pillow is 3.5 inches in it, and it might be just about right for Alexi. Let's check it out. Come back down here, and I'm going to slide it over a little bit so we can see a little bit better. There we go. Come on down there. So this is maybe just a little bit too much support here. I'm guessing that Alexi feels a little bit too much pressure on the back of her neck. Something just smaller, a little bit smaller than this. But the head is actually resting on the mattress. The neck is supported, and the ear is in line with the shoulder, which is where we want it for this kind of coronal plane alignment. All right. So going from there, there's a couple of other things that we might want to do. If there is a patient with a low back problem, especially if the low back tends to curve too much, we might want to support underneath the knees. Okay, so we can just use a regular pillow here and place the knees over that way. This is probably the orthopedically, musculoskeletally kind of most neutral position to sleep in, and the one we recommend to most of our patients. One caution, the only situation where I really would not recommend back sleeping is if you suffer from sleep apnea. or have significant snoring problems. Usually a side sleeping position is better for those conditions. Okay, so I want to just give you one more example of back sleeping. So let's switch Tony in here for Alexi. So I've just switched Tony in here just to make the point about the alignment up at the neck here. Very different body shape. Tony's very thick through the torso. So that means a little bit more support under the head, a little bit more pillow is appropriate. This is pretty close to right for Tony here. The shoulder and the ear are in a good position. You know, if there's a slight movement forward of the head past the shoulder, it's not a big deal, but we really just don't want that to go too much past where the shoulder is aligned here to here. This is, again, just the point that we have to take into account our body shapes, our size, all of that when we're finding the best position to sleep in bed. And here too, I'll come back to the mattress again. If you have a softer mattress, you need less pillow under your head because your body's going to sink into the mattress, which in effect makes that pillow push your head more forward. Okay, so if you like a softer mattress, really consider what you're using for pillows because you're gonna sink into that mattress. A firmer mattress, you'll stay up more on top of that, and more pillow would be appropriate. Okay. Now I said I was going to have a secret for you to keep you from wanting to sleep on your stomach. Let me just go out of the camera here and grab one thing real quick. Now this little method was taught to me about 20 years ago, actually by a chiropractor. If you want to break this habit of sleeping on your stomach, we're going to use a little bit of aversion therapy. Okay, it may be a little unpleasant, but that's the point. What we're going to do is get an old T-shirt, a tennis ball, or some other, let's say non-sharp object. We don't want to cause any damage here, and a roll of duct tape. Okay, you're going to place the ball in the middle of your chest. You're going to duct tape that ball to your old T-shirt all the way around. Strap it on there so it doesn't move. And then when you try to go lay on your stomach, you're going to press into that. It's going to be uncomfortable, and it will, in your half sleep, kind of tell you to get off of your stomach and into your side sleeping or back sleeping position. That tends to work good with a tennis ball, a hairbrush, I don't know, your cat, something. But stick that right on your chest so that when you try to roll onto your stomach, you can't. A couple of other strategies that are maybe a little less aversion-wise. A nice big pillow that is actually fairly long here can, under your knees, can keep you in a back sleeping position because as you try to roll over, the pillow will feel uncomfortable under your knees. All right, that's another way. Some of our patients have been successful with stuffing pillows on either side of them, so that there's something physically there that they feel like they don't want to move out of this position, out of this back sleeping position, and onto their stomach. So there's a few tips for you about what you can do to kind of get yourself out of that stomach sleeping position. Those are the positions that we try to recommend to our patients as we're working through pain issues with them, as we're trying to get them in good alignment. We find that the sleeping position is really pretty vital in most cases, and kind of putting people into a healthy position while they're asleep, just like we try to put them in a healthy position while they're standing or sitting, is really, really key in getting the whole picture here of health and happiness and being pain-free. So thank you for your attention today. If you have any questions about your sleeping position or your pillow or your mattress, this month at the clinic is our sleep month. Very, very important issue. You can come on and see us. We'll do an evaluation for you of your sleeping position and the pillows that you're using. Thanks very much. Come see us at the St. John Clark Pain Treatment Center.